Wearing a mask to reduce the spread of coronavirus will give you carbon dioxide poisoning? As several U.S. states try to enforce the wearing of face coverings in an attempt to stop the spread of the coronavirus, there are some people who are refusing to do this. One of the newest conspiracies being touted as an excuse for this is that wearing masks can result in hypercapnia or carbon dioxide toxicity. Except, with all reasonable face coverings ranging from surgical masks to homemade face coverings and N95 filtered masks, this simply does not happen. The hastily cobbled together graphics and memes currently circulating on social media claim that prolonged wearing of masks can increase levels of carbon dioxide, resulting in a myriad of symptoms. Unless you are a plant, excess carbon dioxide is certainly bad for your health. Hypercapnia, also known as hypercapnia, or carbon dioxide toxicity, can result in an altered mental state, loss of consciousness, an irregular heartbeat, breathing difficulties, and can even be fatal. But few people are at risk of experiencing hypercapnia in their everyday lives, while wearing masks. Face coverings are not. Why? Because carbon dioxide molecules are simply too small to be controlled by the majority of mask materials and simply pass right through. Take surgeons, for example. During long procedures, they wear surgical masks for hours with no ill effects on their carbon dioxide levels. Having a surgeon with an altered mental state would not be in the best interests of either the patient or the surgeon, and thankfully, this simply does not happen. What about tighter fitting masks made from denser materials, such as N95 masks, worn by some healthcare workers coming into close contact with COVID-19 patients? Well, these, only if fitted appropriately, will filter out coronavirus particles. But they do not protect the wearer from gases and small molecules which freely pass through the filter as they are just too small. To protect a wearer from gases, specialized self-contained respiratory equipment is often needed, such as the equipment worn by firefighters when going into burning buildings. Whether to wear face coverings or not is a complex topic, and advice by public health officials varies by state. The rationale behind wearing face coverings is that they will likely reduce the spread of respiratory droplets from the exhaled breath of the person wearing the covering. Not that the covering stops everything coming out of the mouth or nose of that person from being released into the air. So why can masks reduce the spread of coronavirus, but not stop small molecules like carbon dioxide and oxygen from passing through? Well, coronavirus particles have been measured and their size is approximately 125 nanometers, ranging from 60 to 140 nanometers. They are small, so small that they can't be seen under regular microscopes and need specialized ones so that scientists can see them, unlike most bacteria and fungi which can often be seen with light microscopes. But carbon dioxide, oxygen and other gaseous molecules in the air like nitrogen, are much, much smaller than the coronavirus and will pass right through both the filter and main material of an N95 mask and pretty much any other homemade or mass-manufactured mask materials. Although you can't get hypercapnia from wearing a mask, it is a real and genuine concern for people in some environments such as space, where levels of oxygen and carbon dioxide must be tightly controlled to ensure the health of astronauts. Desperately worked to adapt a carbon dioxide scrubbing device designed for one part of the spacecraft to fit the part they were using as a lifeboat. All while coughing as the carbon dioxide levels in the cabin soared. It worked, and they were able to bring the carbon dioxide levels down to a manageable level, but if they hadn't, this certainly would have killed them. Submarines and other large, confined vessels with minimal ventilation are also of concern due to the potential dangers of hypercapnia, and such scenarios have been extensively studied by NASA and the Navy. There is some argument that those with pre-existing breathing problems may experience difficulties wearing masks, but this is unlikely to be relevant for most people and still won't involve hypercapnia. Most people refusing to wear masks while going about their daily business are not going to the moon or entering a burning building. So this particular argument for not wearing face coverings is easily debunked.